Note: please speak to your general care physician about any questions about your health. This video is and has been prepared as an informational guide, not in any form given as medical advice. It is important and advised to speak with your medical team for proper diagnosis. The team at Kidney Conversation makes no claim to be medical professionals, nor are we trained in the medical field. This video, along with all materials associated with this video, are our own experiences and created with research on multiple platforms. Again, it is recommended and advised by Kidney Conversations to seek medical advice from a trained medical professional.
Hello, my name is Jonathan Traylor. I'm the host of Hope with Jonathan.
And I'm Kyle Hockridge from KWM.
And this is Kidney Conversations. And today we ask the question, is there a difference between kidney disease and kidney failure?
So we'd like to start today's show by just giving you a little definition on what is kidney failure and what is kidney disease. So kidney failure is a term used to describe the condition when your kidneys no longer are doing their vital job of removing waste matter from your body. A person with 15 to 0% of their kidney function is in kidney failure, or it is also known as ESRD, end-stage renal disease.
Kidney disease. Kidney disease is broken down into 5 stages, rated from 1 to 5, with stage 5 being the most serious stage. A person in stage 2 of kidney disease is truly in a stage of kidney failure, as the kidneys are not functioning to their fullest, but medically is still classified as stage 2 kidney disease. A person in stage 4 of kidney disease is now classified as a person with kidney failure.
So, Jonathan, as we look at the 5 stages of kidney disease here, we could all say that kidney disease is kidney failure. Just in medical terminology, they don't put it into that form. I mean, you've been there. Would you agree with that?
Absolutely.
Yeah. So, yes, if you have kidney disease, your kidneys are failing in some function. But we'll just go through. Stage 1 of kidney disease is 90% and above, you have considered normal function. In stage 2, you're at 89 to 60% of kidney function, classified as a mild loss of function. Stage 3 is 59 to 30% of kidney function, moderate to severe loss of function.
And stage 4, 29 to 15%, severe loss of function. And you have stage 5, which would be end-stage renal disease or end-stage renal failure, 14% or less. Kidney failure treatment to live is required. Let me expand on this a little bit. I was actually an emergency kidney failure. I actually experienced stage 5 in an emergency sense, and my kidneys had completely failed. Had a lot of different signs and symptoms, but I didn't have enough education like what we're sharing here on the show, and I thought I was fighting the flu. And literally, no, it wasn't the flu. I was in stage 5 end-stage renal disease or end-stage renal failure, and had to be flighted to a local hospital to save my life, to get life-saving emergency dialysis due to the fact that the toxins and fluids had built up on my body, and I was just moments from death. So stage 5 is definitely a scary place to be, and most likely you're going to have dialysis to continue to survive.
Yeah, and with science and technology, anywhere from stage 1 to 4, your nephrologist will be able to help you and hopefully slow down the decline in kidney function. So
Right.
There's treatments available from 1 to 4.
Yep.
And in stage 5, there's only 2 treatments available.
Yep. And I feel like diet and nutrition and medication, all that stuff can go a long way.
Yeah. So treatments of kidney failure, there are only 2 known treatments of kidney failure. Both are considered life-saving treatments. The first treatment would be kidney transplant. So a kidney transplant, for those who don't know, is kidney when kidney failure or just before reaching the stages of kidney failure, a person could receive a transplant from either a friend, family member, or even a stranger called a living kidney donor. The patient could also receive a kidney from someone who has recently passed away. This type of transplant is called a cadaver kidney. The other forms of the only other form of treatment is kind of like a 2A and a 2B is kidney dialysis, which is the cleaning of toxins through the body of one of two ways: hemodialysis or peritoneal dialysis. Hemodialysis, in short, is a cleaning of a patient's blood where they put it. I mean, Jonathan, you want to speak about hemodialysis? You were a patient.
So yeah, hemodialysis is the way that they clean the blood intravenously with needles by sticking one needle into the arterial, the other needle into the venous, and they extract the blood from the body. The blood goes into the machine. The machine cycles through and cleanses the blood through the process of going through the machine, and it's a process called dialysis, and that's how they extract the toxins and the pull some fluid off of you as well. It's a miracle process of hemodialysis. That you can also do this at home, home hemodialysis. I did that as well, and it's a great way to do dialysis. It does have some side effects and things like that. Uh, but we can get into that later. That could be maybe another topic we bring up: side effects of dialysis.
Yeah, and the one that I'm familiar with is peritoneal dialysis, being that my wife does peritoneal. So peritoneal dialysis is when they add a fluid into the peritoneal cavity, which in basic terms is your stomach area. They put a tube in, she gets filled with a fluid. There's two ways of doing it: manual and on a machine overnight. She does the machine overnight, and it fills her with about 2 liters of fluid, and that will stay in for 4 hours. The machine drains it out, and again, cleaning the toxins from her body. That'll go on for 10 hours. So a 2 hour fill, a drain, another 2 hour fill for 10
Yeah.
hours.
And let me mention this really quickly. There's another form of hemodialysis that you can do through another process with a central line that goes into your chest, and they have a port permacath that they can put in, and you can also do hemodialysis through that port that they put through. It's a line that actually gets really close into the region of your heart, and it's a tube that kind of hangs out of your chest with two lines, one for the arterial, one for the venous, and that's how they do dialysis through those lines in your chest with a permacath. So I just wanted to mention that really quickly. So there's a couple of ways that you can do hemodialysis there.
Yeah. So with only two current treatments when you're in kidney failure, it's very important to understand the stages of kidney disease. Your medical team, your nephrologist will be able to control and manage your progress to make living with kidney disease easier. Also, don't forget to educate yourself, as you are your own best advocate. I'm gonna come back here, and I just want to post again, just as a reminder. We can leave it up here for a second. The stages of kidney disease, if you want to take a look at it. It's also posted on our Instagram and Facebook page if you just want to find it. Also very easy to Google. Our webpage going across, kidneyconversations.info. But what I wanted to add there was the conclusion is unclear. If you do have kidney disease, you do have a failure in your kidneys, but you're not in the medical term of kidney failure until late stage 4 and stage 5 for sure. Anything to add to that, Jonathan?
I would just say that if you know that you're heading, stage 3, and you know you possibly could be heading to stage 4, I would definitely start staying definitely on top of your labs, monitoring, your kidney function, your EGFR, your creatinine level. All those things are really going to be important. Definitely paying attention to your dietary choices such as potassium, protein. They're probably going to want you to really try to reserve as much protein, and what we're trying to do is slow down the progression of kidney disease at this point. And just really be mindful of what's going on regarding, diet, things like that. Staying on top of your labs, and also if you know that you're going to be heading toward stage 4, you may be heading toward stage 5. You may want to consider also start looking for a donor before you even consider dialysis. But that could be another topic, another show of another time. But stage 5 is kind of a dangerous place, so you definitely want to be mindful of your labs, stay on top of everything, stay engaged with your medical team. Absolutely.
Yeah. So, I mean, each week we try and bring another topic forward. If you wanted to go back and look at anything that we have done in the past, you can go over to kidneyconversations.info. We're building a great source of information there. Remember, you don't get your medical degree from Google as well. So we highly recommend dealing with your medical team, talking with your medical team, but getting the knowledge in the meantime. And that's why we created this platform to help you.
Absolutely. In no shape or form are we giving anyone a diagnosis or medical diagnosis or anything like that. We're just sharing information from our stories, from our walks of life. And we hope you guys enjoyed this. I hope we answered the question for you. Is there a difference between kidney disease and kidney failure? Absolutely, there is. But the two, kind of go hand in hand. And hope you guys appreciate what we're doing here with Kidney Conversations. You get a chance, please go check out our YouTube channel, Hope with Jonathan. Hit the bell. You'll be notified of all of our great content coming your way from Kidney Conversations.
All right. Thank you, everyone, for joining us, and have a wonderful night.
Stay blessed, everyone.
Note: please speak to your general care physician about any questions about your health. This video is and has been prepared as an informational guide, not in any form given as medical advice. It is important and advised to speak with your medical team for proper diagnosis. The team at Kidney Conversation makes no claim to be medical professionals, nor are we trained in the medical field. This video, along with all materials associated with this video, are our own experiences and created with research on multiple platforms. Again, it is recommended and advised by Kidney Conversations to seek medical advice from a trained medical professional.